Hello, I'm Carolinda. Welcome back to my channel. Today I'll be showing you what's in my bag and how I pack my bag. This is my mobile case that I take with me to my clients, and I'll show you what's in my bag and how to pack it. And this is what I take when I go see my clients. Want to see what's inside this bag? Stay with me. Hello, welcome back to my channel. Today I'm cleaning out my cards that I use, and I figured out it would be a good day to show you what's in my bag. All right. So let's clean this stuff out. I'm almost done here. I'm almost done with the other one. But so I do have this card right here, and I have three shelves. So on the first shelf, first shelf, I do put like the things I need to reach really fast. I do set them all in here. Let's do the first layer first. It's dry. Okay, there we go. First, I have this um, towelettes. They are like antiseptic wipes that I use to clean the toes before starting. I put them in there in the middle. I do have on there, of course, I do carry some of my cards. They go in there. I do have this is like for my burrs. They go right next to that one. And I always carry extra burrs just in case, never know. Carry some in there. Next is my my E5. I do put it to in here where it's very accessible, and they go on top of that one. This right here is just some pedicure knives that I barely use, but it's good to have it. Sometimes I use it, sometimes I don't. And next I have my powder sprays. They go in there. I have my lotion, and this is like a fungus lotion that I put on toes. They go right in next to each other. Then next I have my packs. There's some cleaning. They sit right there next to my wipes, my files. They all go right in this corner. I also have this monofilament stuff. Put it right there. Need it to test for like circulation and stuff, diabetic test. Of course, you're gonna need a pen. They also go up front right there. This one is Q-tip. I use it sometimes for like a Lumicane. I use it with my Lumicane, or sometimes I use it with, if I have to. I've never had to use it yet. My antibiotic, so it's first aid. Since it is long a little bit, if it's right in here, the first part, these are my blades. It's long, so it needs a longer space. I put it right in the middle right there. And so my glasses, my goggles, I got this. It is so cute. Look at that. Anyways, they go up top. So what I really need to reach all the time every day, they sit up top. And obviously I carry my chargers for my lights, my headlamp, and for the charger for the E5. They all go right there by the corner, right there by the corner right there. Of course I have two, just in case one dies on me in the middle of whatever. I can always have a backup. All right. And then this little tray right here is what I put my stuff in, like you can sit it down. When that is filled up, you cover it up. Second drawer is where I put all this little stuff. So I do have full size of every little one of these. I just take some and put it in this bag. These are like, if I want to treat somebody that has nail polish, I can use that. And I have a nail polish remover right there. Those go to the bottom because those are like bottom stuff that will go in there somewhere. I do have my cuticle remover, my cuticle oil. They go right there in the middle. And gentian violet, they go right in them little boxes. I need to refill this one. These are my gloves. I don't want to carry the whole box because it's a little bit, it's a lot. But I need to refill. Just go one, they fit in one of those pockets right there. I also have, these are aprons. So I just wear an apron. That way I can just take out everything, put it in the trash. So I carry aprons. They fit in one of them little cubicles. That's my Lumicane. Goes with the gentian violet. This is like urea cream, 40%. It's not open because it's something that if a customer wants, I can just, either sell it or give it out. Also, this is also like 2x2 gauze. Again, first aid. I have this Coban that I can use because I don't want to use tape. Some people are allergic to band-aids and stuff like that. So I can use this if I need it. I've not had to use it yet. That's why it's still in packages. But I carry it just in case I need it. So those are my first aid and my band-aid. They go in there. And this right here is my blade carrier. As you can tell, there's a little bit in there. When it's full, I just put that in the trash. Not trash, sorry. Take it to a shops, people, where they can put it in their shops container. All right. This is like a lamb's wool. If I need it, I have it. I put it in one of those boxes right there. That's my triple antibiotics that I use with my cuticle. Q-tip. That goes in one of them boxes, one of my little boxes right there. And I have my this N95 KN95. This is a KN95 one, and these are just regular masks. So they also go in one of them boxes with this one right here. So actually that goes right there. Okay, so that fills up. Oh, my little standing bands. I put it in one of them over there. That goes in here with these ones because those are all nail stuff. All right, and these will go in that bag right there. And no, that one goes in there. This one goes with this one right here. Lamb's wool and cotton, because they are almost the same kind of thing. And that does it for the second drawer. The third one is where I put all this other stuff, like I named them other stuff. These are pads that I can use. So since it's big and I don't want to take it out and put it in something else, I just put it right there in case I need it. And this, I have bigger bottles of stuff, but I just put them in smaller little things to make it easier for me to carry. This is hydrochloric acid. This is 3DW that is mixed already. I refill it every time that I need to. These are all like, this used to be a wound wash container, wound cleanser container. So I just put hydrochloric acid in there for me, and it's easy for me to use because it has that, and I hang it right there. When I'm using this one, I got it from one of them Dollar Trees. This is like a shoe cover. If you go into somebody's house when it's rainy and muddy, you don't want to just get in people's houses with mud. I use this to cover my shoes up. It goes right at the back. These are still pads. Toenail. It's a hammer toe crunch. So these are all for pads and crutch. Hammer toe. Little things. They go back here with the other ones. Like I said again, nail polish remover goes back there. I carry my own surge protector just in case I need it. I've not had to use it yet, but this is really cool. It has all of this and has like a USB port too. They go back there. I carry extra I just carry this. You never know what I might need for it, but I just put it in my purse. I just carry it for whatever whatever may come. So they go back there for just whatever. And of course, the trusty puppy pads is what I carry. They go. This one was supposed to be like I put it on the floor to cover the house, like the floor. And it, I've used it once, it works. But there you have it. The puppy pads also, I need to refill that too. They go right there. Very trusty little things. I use them every single minute of it. And then I have just regular lotion, even though I have another one over there that I use all the time. This one is just, like I said, backup for everything. You gotta have backups, you know. This it's can rest your toe there for like somebody who's bed bound, or somebody just need extra support. You can put your leg on there and I can work with it. I put it right back here. And so these are also cleaning. This is a sanitizer that I made myself. Yeah, it's isopropyl alcohol and glycerin and some good stuff, so it's not all drying out. But this is self-made and I've used it a couple of times. It works actually. It's like the same stuff that's made with hand sanitizer, just make it in there. So there you have it. It's part of my cleaning clue. So bottom drawer is mostly cleansing things. This is my dirty bin. As you can see, it has stuff in there, so I'm gonna wash that. I'm not gonna put it in there, just I'm gonna put it back in there because it needs to be washed. This sunny cloth, of course, bubble top, germicide, it kills everything. That's what I used to clean my stuff, sanitize everywhere before I put it back. And this is also a disinfecting wipe that I carry. Like if I just need to clean something that it doesn't really need like a germicide or thing or something, I don't know what that may be, but I use it sometimes to like wipe down a chair or something that is not super dirty. So I carry that. And of course I have wipes that I use to clean the legs, toes, feet, whatever. And these are my tools. So I will sit on this one, and then I'll put your leg on this one. This one is very adjustable. You can just change it to the height that is comfortable for my patient or my client. Just adjust it as it needs to. And I sit on here 9 times out of 10. I'll sit on the floor, but I have this. These are my sitting equipments, and collapsible and fits right in here perfectly. Both of them fit right in there, perfect. And then this one, collapse it, and it goes right in there too, right at the back of this one. That's how it usually sits. Oh, it doesn't want to sit now, but yeah, it goes right in there. And this one sits in front of it, and this one sits right there. Very accessible. Alrighty, and that's it. Oh, this is like a toe separator. They also go just right in there in the middle. So all right, this is what it looks like when it's all said and done. So that's what it looks like. And this opens like that, and ta-da, then that's what it looks like. And so this is very handy. It fits everything that I need to carry in it. Alrighty, and put it there, and lock it. There it is. That's how it is. And then I just pull this up, and carry it like that, and off I go. It's very handy and very maneuverable. Very easy to carry around. Alrighty. Bye bye. See you later.